Welcome to the updated Dr. Bernstein podcast. Please check the description for the original sources and a reminder that all content is general in nature and should not be considered medical advice.
Right.
Today, we're doing a deep dive into diabetic neuropathy.
Ooh.
And we're going to be looking at how Dr. Bernstein's ideas about tight glucose control line up with current scientific understanding. Neuropathy is a big issue for lots of people with diabetes.
It really is. It's so prevalent.
And there's just so much research out there, it can be hard to keep up. So that's where we come in.
Absolutely. We've got a ton of research to go through. We're going to look at Dr. Bernstein's own writings.
Right.
We're going to look at what's on PubMed.
Right.
And we're going to try and find, what are the most important takeaways.
Exactly. We'll cut through all the noise and figure out, what really matters for understanding neuropathy, especially how Dr. Bernstein's recommendations line up with, or maybe even don't line up with, current scientific thinking. So let's get started. And I think a good place to begin is with Dr. Bernstein's core philosophy, right?
Sure.
He's really been a proponent of tight glucose control,
Absolutely.
arguing that keeping blood sugars as close to normal as possible is really key for preventing all sorts of complications, including neuropathy.
Yes. That's one of his main points. The closer you are to a non-diabetic blood sugar, the better.
Right, that's his big thing.
Yeah.
But does the science actually back that up?
Well, it depends.
Especially when it comes to neuropathy.
Yeah.
What does the research actually say?
So when we look at the research on PubMed, it gets pretty interesting.
Okay.
So for folks with type 1 diabetes, the evidence is really strong.
Okay.
Tight glucose control does seem to halt the progression of distal symmetric polyneuropathy, or DPN,
Got it.
which is that most common type that usually starts with the tingling, numb feet.
Right. So score 1 for Dr. B,
Yeah.
at least when it comes to type 1 and DPN.
Right.
But I bet it's not that simple across the board.
Right. Yeah.
What about type 2 diabetes?
Yeah, type 2, always a bit more complicated.
Okay.
Managing your blood sugar is still important, for sure.
Right.
But the research actually paints a little bit of a less clear picture.
God.
And it seems like other factors might play a bigger role in neuropathy development for folks with type 2.
Interesting. So it's not just a blood sugar game for everyone.
Right.
What are some of these other factors that could be at play?
Well, hypertension is a big one. We've got studies, one by Barbosa, showed a really strong connection between high blood pressure and an increased risk for neuropathy, especially the kind that comes with pain.
Okay.
In fact, some research even suggests that for type 2, high blood pressure might be a stronger predictor of painful neuropathy than even high blood sugar.
Wow. So for someone with type 2, managing their blood pressure could be just as crucial as managing their blood sugar
Yes.
when it comes to preventing that painful neuropathy. I hadn't even realized it was that significant. But there's got to be more to the story than just blood pressure and blood sugar.
Absolutely. Obesity, for example,
Okay.
especially in younger folks with type 2, seems to up the chances of developing neuropathy. And a study by Reesers highlighted that it's not just about the extra weight. It seems like obesity can actually trigger inflammatory processes in the body, and that chronic inflammation can really damage those nerves over time.
Right. Inflammation. Right. It seems to be popping up everywhere these days. It's like the body's alarm system
Yes.
going haywire.
Yes.
If it doesn't chill out, then things start to break down,
Exactly.
including those delicate nerves.
Exactly. And to make things even more complex, researchers are finding these biomarkers in the blood
Okay.
that seem to be linked to neuropathy development.
Great.
One, for instance, studies by Wiss and Baldinci have shown that high levels of a protein called TIMP1 are associated with an increased risk for neuropathy,
Okay.
which is really fascinating because it opens up this possibility of early detection through blood tests. You could potentially catch the nerve damage
Right.
before someone even feels any symptoms.
Talk about a game changer.
Yeah.
Right. If you could identify people who are at risk before the damage is done, I mean, you could really make a difference.
Right.
So I'm seeing a pattern here,
Yeah,
right? Blood sugar is definitely a factor,
it is.
but it's not the whole story.
No.
It's like pieces of a puzzle,
Yes,
and we're just starting to see how they fit together.
exactly.
And some of those pieces might even challenge, like, what we think we know.
Right.
For example, Dr. Bernstein is really specific about which blood sugar lowering medications he recommends.
Yeah.
But a study by Johansson found that C-peptide, which is a naturally occurring substance, might help alleviate certain neuropathy symptoms.
It's true.
C-peptide, huh? Now, that's something that Dr. Bernstein doesn't really talk about much. I'm curious, what's so interesting about this C-peptide?
Well, we definitely need more research, to be sure, but this study suggests that it might actually help repair some of the nerve damage that's caused by diabetes, which is a big deal because right now there's no cure for neuropathy. We can only manage the symptoms.
Right.
So if C-peptide can truly help regenerate nerves, that would be a huge step forward.
That's where it gets really interesting, right?
It
A
is.
potential treatment that actually targets the root of the problem, not just masking the symptoms.
Yeah.
So what stands out to you so far from all this research?
I think for me, it's just the complexity of neuropathy. It's not this one-size-fits-all condition. Different types manifest in different ways. The underlying causes can vary widely.
Right, it's like we're looking at a forest, not just a single tree.
And speaking of different types of neuropathy, we've been focused a lot on DPN,
Yes.
that classic foot neuropathy. But I know there's another type that Dr. Bernstein really emphasizes,
Right.
cardiac autonomic neuropathy, or CAN.
Yes.
This one affects the nerves that control your heart. Right?
Yeah.
Exactly. And this is where things get even more serious.
Okay.
While DPN can impact your quality of life,
Right.
can be life-threatening
Got it.
because it affects how your heart functions.
Right.
It can be completely silent,
Mhm.
meaning you might not have any symptoms until a major cardiac event happens.
Okay, now that's scary.
Yes.
And I know Dr. Bernstein is a big proponent of early detection and prevention, especially for CAN.
He is, for good reason.
Mm-hmm.
Research shows that CAN often goes hand in hand with DPN.
Okay.
A study by KISS even suggests that we might be able to predict CAN by doing nerve testing on the peripheral nerves,
Interesting.
like the ones in your feet.
So if you've got DPN, you might be at a higher risk for CAN,
Yeah.
even if your heart seems fine right now.
Exactly.
That's a pretty powerful connection. It seems like the more we learn, the more interconnected everything becomes.
It really does. Yeah, we're starting to see this much broader picture of neuropathy,
Right.
which is incredibly valuable for understanding how to manage it and potentially prevent it.
Absolutely. And this is just the beginning of our deep dive. We've still got a lot more to unpack when it comes to CAN,
Yeah.
the latest research on potential treatments, and what it all means for you.
Yeah, definitely. Stay tuned. We'll be right back. All right. Welcome back to our deep dive on diabetic neuropathy. Before we took a break, we were talking about how having DPN, that foot neuropathy, could mean that you're more likely to also have CAN.
Right. Even if you don't have any noticeable heart symptoms.
Right.
Which is a big deal because CAN can be really serious.
It really is.
So just to remind everyone, CAN affects the nerves that regulate your heart function.
Yes. Things like your heart rate, blood pressure, how your heart responds to changes in your body's needs.
Right. And because it can be silent, you might not even realize anything is wrong until a major cardiac event happens.
Exactly.
And that's what makes it so scary. It's like a ticking time bomb that you don't even know you have.
It is.
So how can someone even know if they have CAN? Like, are there specific tests for it?
Yeah, there are specific tests. They look at how well your heart responds to different stimuli,
Okay.
like changes in breathing or posture.
Okay.
So, for example, one test measures your heart rate variability while you do deep breathing exercises.
Got it.
And another test checks how your heart rate and blood pressure adjust when you stand up from lying down.
Okay, so it's not just about checking your pulse.
Right.
It's about seeing how your heart adapts to different situations.
Exactly.
That makes sense. But these tests sound kind of, well, medical.
Mm-hmm.
Is there any way to kind of get a sense of your heart's autonomic function outside of a doctor's office?
Actually, there's some really interesting research happening with wearable technology.
Oh, cool.
Some smartwatches and fitness trackers can actually measure heart rate variability,
Wow.
which can give you some insights into how your autonomic nervous system is doing.
Okay.
Of course, it's not a substitute for those formal diagnostic tests,
Right.
but it could be a useful tool for monitoring trends and maybe even flagging any worrisome changes.
That's really cool. I could see Dr. Bernstein getting behind that.
Oh, yeah.
He's always been like a real proponent of patients taking an active role in their health.
Absolutely.
But going back to this connection between CAN and DPN, why is it so important to understand?
Well, for one thing, it really highlights how systemic diabetic neuropathy can be. It's not just isolated damage to the nerves in your feet or hands. It can affect multiple systems in your body,
Right.
including your heart, which is obviously vital.
Right. So it really reinforces the idea that diabetes is a complex condition.
Yes,
And it needs a comprehensive approach to management.
it does.
And understanding this link between CAN and DPN can help guide treatment strategies, right?
Absolutely. So if someone's diagnosed with DPN, it's really crucial to also check for CAN,
Yeah.
even if there aren't any clear heart-related symptoms.
Makes sense. Early detection is key.
Mm-hmm.
But what about the underlying causes of both DPN and CAN?
Yeah.
Are they like the same culprit at work in both cases?
So the exact mechanisms are still being studied, but high blood sugar definitely plays a major role in nerve damage
Right.
in both types of neuropathy. Think of it this way. When your blood sugar is consistently high, it's like this slow burning fire
Okay.
that damages those tiny blood vessels that are responsible for supplying nutrients to your nerves.
Well, I like that analogy. Slow burning fire.
Yeah.
That really helps visualize what's happening.
Right. And over time, this damage can lead to neuropathy in different parts of the body,
Oh.
including your feet and hands,
Right.
and critically, your heart.
But we talked about how, other factors besides blood sugar can contribute to neuropathy.
Right.
Does that apply to CAN as well?
Absolutely.
Okay.
High blood pressure, obesity, chronic inflammation, they've all been implicated in the development of CAN. And this brings us back to that holistic approach to managing your diabetes. It's not just about focusing on blood sugar levels, it's about addressing all these risk factors
Right.
to protect your nerves and your overall health.
It's like this web of interconnected health challenges.
Yeah.
You can't just address one thread without considering the whole picture.
Exactly.
This kind of aligns with Dr. Bernstein's philosophy in a lot of ways, even though his primary focus is on glucose control.
Right.
He also, emphasizes the importance of healthy lifestyle choices,
He does.
addressing other risk factors.
Yeah.
So while Dr. Bernstein might be best known for his really strict approach to blood sugar, he actually takes a broader perspective when you look at all of his recommendations.
He does.
That's good to know. But let's get practical for a moment. What can people do to reduce their risk of developing these neuropathies?
Well, the first and most important thing, as Dr. Bernstein constantly emphasizes, is to aim for near normal blood sugar levels. That means following a healthy eating plan, getting regular physical activity, taking your medications as prescribed,
Right.
and carefully monitoring your blood sugar.
Okay, so blood sugar control is the foundation.
It is.
All right.
Managing your blood pressure is just as important.
Okay.
So if you have hypertension, work with your doctor to get it under control, through lifestyle changes and, if needed, medication.
Right.
Weight management isn't just about looking good.
Right.
It's about reducing inflammation and protecting your organs,
Right.
including those delicate nerves.
So it's a combination of healthy habits and proactive medical care.
It is.
Sounds like a lot of responsibility. But what about specific treatments for CAN? Are there medications or therapies that can actually help?
So the main focus for treating CAN is managing the symptoms and preventing complications.
Okay.
This might involve medications to regulate heart rate, blood pressure, or even digestion, depending on what symptoms you're experiencing.
So it's about kind of dealing with the consequences of the nerve damage.
Right.
Are there any treatments that actually target the nerve damage itself?
There are some new therapies that are being explored, like nerve growth factors and stem cell therapy.
Wrong.
But these are still in the really early stages of research. We need more studies to confirm if they're truly effective and safe.
Right. Stem cell therapy for neuropathy. Now that sounds like something out of science fiction.
It does.
It's amazing to think how far research has come.
It is.
But let's shift gears a bit and talk about something that affects a lot of people with neuropathy, pain.
Yeah.
We've mentioned painful neuropathy a few times, but I think it really deserves a closer look. What makes this type of pain so difficult to manage?
So pain from diabetic neuropathy is often described as burning, tingling, stabbing, or even like electric shocks.
Oh, wow.
It can be constant or come and go. It can be mild or severe.
Got it.
And it can really disrupt your sleep, your mood, your ability to do everyday activities.
Yeah, I can only imagine how debilitating that must be.
Yeah.
It's like your own body is betraying you.
It is. It's incredibly challenging for those who experience it. And unfortunately, traditional pain relievers, like over-the-counter painkillers or even opioids, often don't work very well for nerve pain.
So what options do people have for managing this pain?
Yeah.
There's got to be something that can help.
There are several approaches, but it often takes a multi-pronged approach, combining different strategies to find what works best for each person.
Okay.
Some common options include certain types of antidepressants
Okay.
anticonvulsants,
Got it.
and topical medications.
Antidepressants and anticonvulsants.
Yeah,
Those aren't usually what you think of when you think of pain relief.
right.
How do those help with neuropathy?
It might seem counterintuitive, but these medications can actually target specific pathways involved in how the nerve pain is transmitted,
Okay.
even though they were originally developed for totally different conditions.
Right.
So, for instance, some antidepressants can actually increase the levels of neurotransmitters,
Okay.
like serotonin and norepinephrine,
Got it.
which play a role in modulating pain. And some anticonvulsants can help stabilize nerve activity, which reduces those pain signals.
So it's like repurposing these existing medications to address the unique challenges of nerve pain.
It is.
Clever.
Yeah.
What about topical medications? What are they typically used for?
So topical medications are applied directly to the skin,
Okay.
providing localized pain relief.
Okay.
They often contain ingredients like lidocaine, which can numb the area, or capsaicin, which creates a warming sensation that can temporarily override those pain signals.
So it's about finding ways to disrupt the pain messages.
Yeah.
Whether from the inside out or the outside in. I like that. But medication isn't the only option, right?
No.
I've heard that certain therapies can be helpful as well.
Yes, you're absolutely right. Non-drug approaches like physical therapy, transcutaneous electrical nerve stimulation, or TNS, and acupuncture can also provide relief for some people.
Physical therapy for nerve pain. How does that work?
So physical therapy can help in several ways.
Okay.
Gentle exercises can improve blood flow to the affected nerves. They can reduce muscle stiffness
Okay.
and help you maintain your mobility. Therapists can also use techniques like massage or a manual therapy to ease tension and reduce pain.
So it's about addressing the physical aspects of the pain.
Exactly.
What about 10NS? That sounds pretty high-tech.
It is. So 10NS involves using this small device that delivers electrical impulses to your skin.
Okay.
And these impulses stimulate the nerves and can potentially block those pain signals from reaching your brain.
Got it.
It's a non-invasive option that can be quite effective for some people.
Interesting. And acupuncture. I know it's this ancient practice that's becoming increasingly popular these days.
It is.
How does it fit into pain management for neuropathy?
So acupuncture uses very thin needles that are inserted into specific points on the body.
Okay.
While we're still learning exactly how it works, it's thought to stimulate the release of endorphins,
Okay.
which are your body's natural painkillers.
Right.
And it might also help modulate nerve activity,
Okay.
reducing your perception of pain.
So it's about harnessing the body's own healing powers.
Yeah,
We've covered a lot of ground here, from medication to alternative therapies.
we have.
But I'm curious, what role does surgery play in managing diabetic neuropathy?
Yeah.
Is that ever considered?
So surgery isn't usually a primary treatment for diabetic neuropathy itself.
Okay.
However, there are cases where surgery might be needed to address specific complications that can arise from neuropathy.
Got it.
So, for instance, if someone develops severe foot deformities because of nerve damage, surgery might be necessary to correct those deformities
Okay.
and prevent further problems.
So it's more about managing the downstream effects of neuropathy,
Right.
not the nerve damage itself.
Exactly.
Makes sense. But let's zoom out a bit and talk about something we touched on earlier. Prevention. We know high blood sugar is a big driver of neuropathy.
Yeah.
But what about people who haven't developed it yet?
Right.
Are there any, red flags or early signs they should be watching for?
That's a great question. And it's an area where we need more research.
Okay.
Right now, there aren't any definitive early warning signs that can tell us for sure who will develop neuropathy.
Right.
However, there are certain risk factors that can make you more vulnerable.
Like what? Give us the rundown.
So besides the usual suspects like high blood sugar, high blood pressure, and obesity,
Right.
other risk factors include smoking, alcohol consumption, and even certain genetic predispositions.
So it's a combination of lifestyle choices and genetics.
It is.
What about specific symptoms? Are there any, subtle clues that someone might be developing neuropathy?
So one of the earliest symptoms of DPN, that most common type, is often a loss of sensation in the feet, especially in the toes. So you might experience numbness, tingling, or a pins and needles feeling.
Got it.
Some people also feel pain, burning, or even coldness in their feet.
So paying attention to any changes in foot sensation is crucial.
Yes.
It's like your feet are trying to tell you something's not right.
Yeah.
What about CAN? Are there any early symptoms of heart-related nerve damage?
So can be a little trickier to catch in its early stages because it often doesn't cause any noticeable symptoms.
Okay.
However, some people might notice an abnormally fast or slow resting heart rate,
Hmm.
dizziness or lightheadedness when standing up, or even digestive issues like nausea or constipation.
Wow. Those symptoms seem so unrelated to heart health.
Right.
It just shows how diverse the manifestations of neuropathy can be.
Yeah.
But if someone suspects they might be developing neuropathy, what should they do?
The most important thing is to talk to your doctor.
Okay.
They can assess your risk factors,
Right.
do a physical exam, order any necessary tests to either confirm or rule out neuropathy. Early detection is so important
Right.
because the sooner you identify and address any nerve damage, the better your chances of slowing its progression and preventing further complications.
It's all about being proactive and taking charge of your health.
Exactly.
This deep dive has been so eye-opening, really highlighting how complex diabetic neuropathy is.
It is.
And we've covered so much, different types, risk factors, symptoms, diagnoses, treatment options. It's a lot to take in.
But before we wrap up, what are the most important things our listeners should remember about diabetic neuropathy?
I think the biggest takeaway is that diabetic neuropathy is a serious condition that needs your attention
Right.
and proactive management.
Absolutely. It demands respect.
It does.
What else?
Early detection is key. Pay attention to any changes in sensation, especially in your feet.
Right.
And don't hesitate to talk to your doctor if you notice anything unusual.
Be your own health advocate. Any
Yeah.
other words of wisdom? Remember that managing your diabetes well is the best way to lower your risk of developing neuropathy and other complications.
Right.
That means aiming for near normal blood sugar levels, managing your blood pressure, maintaining a healthy weight, and adopting a healthy lifestyle overall.
It's a holistic approach. Medical care and healthy choices working together.
You do?
But we're not done yet, are we?
Oh.
There's still more to uncover in our deep dive on diabetic neuropathy.
Right. In the next and final part, we'll delve into some of the newest research, look at potential future treatments, and leave you with some thought-provoking questions to ponder.
Sounds like we're in for a fascinating finish. Stay tuned for part 3. Welcome back to our deep dive into diabetic neuropathy. We've covered so much already, but I'm really excited for this last part. We're going to explore some of that cutting-edge research and talk about what the future might hold for treating neuropathy.
Yeah.
Seems like new discoveries are happening all the time.
They really are. It's a really dynamic field. And researchers are really pushing the boundaries of what we know about neuropathy and how to address it.
Speaking of pushing boundaries,
Yeah.
one area that seems to be getting a lot of attention these days is that role of inflammation in neuropathy.
Right.
We've talked about it a little bit already, but it seems like the research is really starting to solidify this idea that, chronic inflammation is a major player in nerve damage,
It is.
even when blood sugar isn't super high.
Exactly. Yeah, it's not just about sugar anymore. We're seeing more and more evidence that chronic inflammation, that kind of constant state of immune system activation, can be really damaging to nerves over time.
It's like having this low-grade fire smoldering inside,
Yeah.
slowly wearing down your body's defenses,
Right.
including those crucial nerves.
Yeah.
Which kind of raises a big question. If inflammation is really this central to neuropathy, could anti-inflammatory drugs be the key to preventing it or even treating it?
That's the million-dollar question.
Yeah.
And researchers are definitely on the case. Some studies are looking at existing anti-inflammatory medications to see if they can be, repurposed for neuropathy.
Right.
Others are working on developing brand new drugs that specifically target the inflammatory pathways that are involved in nerve damage.
That's incredibly promising. Imagine like a future where we could prevent or even reverse nerve damage with like a simple pill.
Right.
I mean, it would be a game changer for so many people. What else is happening on the research front that you find particularly exciting?
Another area I'm really interested in is the development of more sensitive and specific diagnostic tools.
Okay.
We know early detection is absolutely crucial for effective intervention.
Right.
So researchers are working on new imaging techniques and blood-based biomarkers
Okay.
that could, pinpoint nerve damage in its very earliest stages, even before any symptoms show up.
Wow, that would be amazing. Being able to see those subtle signs of nerve damage before they become a major problem, I mean, that would revolutionize how we approach neuropathy.
It would.
It's like having a high-powered microscope
Yeah.
that can spot these tiny cracks in the foundation before the whole building starts to crumble.
Yeah, I like that analogy.
Early detection is all about getting ahead of the curve,
It is.
addressing the issue before it becomes a full-blown crisis.
Yeah.
And Speaking of exciting new possibilities, what about treatment? Are there any, like, novel therapies on the horizon that you're particularly enthusiastic about?
One area that holds a lot of promise, though it's still really early days, is stem cell therapy.
Okay.
Stem cells have this incredible ability to transform into different types of cells,
Right.
including nerve cells.
Hmm.
So researchers are exploring ways to use stem cells to actually repair damaged nerves and regenerate lost tissue.
Stem cell therapy for neuropathy. That sounds almost like science fiction.
It does.
What's the kind of current state of research in that area?
It's still experimental, but the early results are definitely encouraging. There are several clinical trials underway right now to evaluate both the safety and effectiveness of stem cell therapy for diabetic neuropathy.
Okay.
It's too soon to draw any, definitive conclusions, but the potential of this approach is huge.
It's like tapping into the body's own innate healing power
Right.
and giving it a boost. The idea that we might be able to regenerate damaged nerves, that's mind-blowing. But amidst all this excitement about, new research and these potential breakthroughs, it's important to remember that we already have tools and strategies that can make a real difference in managing and preventing neuropathy right now.
You're absolutely right. The fundamentals of good diabetes management are still crucial.
Yeah.
Tight glucose control, managing blood pressure, maintaining a healthy weight, getting regular exercise, not smoking. All of these things play a vital role in protecting your nervous system.
Right, it's like building a fortress to defend against those diabetic complications.
Right.
Exactly. And while Dr. Bernstein's main message has always been about the importance of tight glucose control, he also emphasizes these other lifestyle factors as part of that comprehensive approach.
So it's a multi-pronged attack, right?
Yeah.
Taking care of your blood sugar while also addressing all these other risk factors.
Yes.
It's about being proactive on every front. But sometimes, even with the best efforts, neuropathy can still develop. So what advice would you give to someone who is struggling with this really challenging condition?
Well, first and foremost, don't lose hope. There are so many resources and support systems available to help you manage neuropathy and maintain a good quality of life.
Right, where can people find those resources?
The American Diabetes Association and the Foundation for Peripheral Neuropathy are great places to start. They offer tons of information support groups and, connections to healthcare professionals who specialize in neuropathy.
Okay, so it's about building a team to support you on your journey with neuropathy.
Exactly. And don't be afraid to advocate for yourself. If you're experiencing pain or other symptoms, talk to your doctor. There are various treatment options available. Finding the right combination for you might take some trial and error, but it's worth the effort.
It's a journey,
It is.
and it might have its ups and downs, but you don't have to go through it alone.
Absolutely. And as research continues to advance, we're likely to see even more effective treatments and prevention strategies in the future.
That's definitely something to look forward to. Any final thoughts or words of wisdom to leave our listeners with?
I think as we've seen throughout this deep dive, diabetic neuropathy is a complex condition and our understanding of it is constantly evolving. But with proactive management, a positive attitude, and the support of, a knowledgeable healthcare team, you can navigate this challenge and live a full and fulfilling life.
Well said. It's a message of hope and empowerment. And that brings us to the end of our deep dive into diabetic neuropathy. It's been a fascinating journey exploring the science, the challenges, and the promising future of this condition. Remember to like and subscribe, and thank you for listening.